Module 3, Preventive Healthcare, Risk and Protective Factors, and Supporting Lifestyle Change. After completing this module, participants will be able to define risk and protective factors of chronic diseases, describe key risk and protective factors, understand lifestyle behaviors and its importance, and understand strategies to modify unhealthy lifestyle behaviors. So what is risk and protective factors? A risk factor is a trait or habit that makes it more likely to have a disease. For example, smoking is a risk factor of lung cancer. On the other hand, a protective factor is a trait or habit that protects people from getting a disease. For example, exercise is a protective factor for chronic diseases. Protective factors keep us healthy and risk factors increase the chance of getting a disease. As you can see in the diagram as well, risk factors increase the risk for disease, while the protective factors prevent or minimize disease. Most well-known risk factors for chronic disease includes smoking, poor nutrition, obesity, high blood pressure and high cholesterol, while the protective factors can be exercise, healthy eating, controlling weight, controlling cholesterol, medical screening, and immunization. Physical exercise increase muscle and bone strength, improve mood, reduce anxiety and depression, help manage weight, boost energy, improve sleep pattern, reduce falls among older adults, and reduce arthritis pain. While the low activity raises the risk of heart disease, stroke, type 2 diabetes, colon cancer, high blood pressure, obesity, osteoporosis, and so forth. It is recommended that adult people should have an average of 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity physical activity, or a combination of them each week. All older people should do some form of physical activity, and they should accumulate at least 30 minutes of moderate intensity physical activity on most, preferably all days. Good nutrition can keep a person healthy and feeling good, but poor nutrition can be harmful. Good nutrition means eating a healthy diet of fruits and vegetables, grains, fat-free or low-fat milk products, lean meats and nuts. While the poor nutrition means eating a lot of saturated fats, sugar and salt, as well as eating fewer healthy foods. In Australia, among the adult population, 1 in 2 eat the recommended 2 serves of fruits daily. 1 in 10 eat the recommended 5 to 6 serves of vegetables daily. 1 in 7 made the recommended 2 to 3 serves of lean meats and alternatives. 1 in 10 made the recommendation of 2.5 to 4 serves of dairy products and alternatives. 1 in 10 consume sugar sweetened drinks daily. And daily salt consumption is 9 grams. That's much more than the recommended upper limit of 6 grams per day. Overweight means having above normal body weight or weighing too much for one's height, whereas obesity means having a very high amount of body fat. Obesity increases the risk of diabetes, heart disease, stroke, arthritis, cancer, sleep apnea and respiratory problems, liver and gallbladder disease. Overweight or obesity person may need to make changes to their diet or become more active. 1 in 3 Australian adults were obese in 2017, which is an increase from 1 in 5 in 1995. Normal blood pressure is 120 by 80 millimeter of mercury. The first and highest number is called the systolic pressure, while the second and lower number is diastolic pressure. The World Health Organization defines high blood pressure as having systolic blood pressure greater than or equal to 140 millimeter of mercury, or diastolic blood pressure greater than or equal to 90 millimeter of mercury, or receiving medication for high blood pressure. High blood pressure or hypertension can lead to heart disease, stroke, and kidney failure. In 2017 and 18, 1 in 4 men had measured high blood pressure compared with 1 in 5 women in Australia. There are 2 types of blood cholesterol. One is high density lipoprotein, which is termed as good cholesterol, while there is another cholesterol called low density lipoprotein, which are known as bad cholesterol. Too much bad cholesterol and less good cholesterol in our blood can lead to heart disease or stroke. 1 in 3 Australian adults have high level of LDL cholesterol, which is the bad cholesterol, and almost 1 in 4 have low levels of high density lipoprotein, which is termed as the good cholesterol. To manage the blood cholesterol, one is advised to get a blood test, eat a healthy diet, control their weight, get exercise, quit smoking, and take medication. Smoking is the most preventable cause of disease and death in Australia. The latest data estimated that 11.6% of adults in Australia smoked daily in 2019. Smoking is a risk factor for heart disease, chronic lung disease, several types of cancers. Spit tobacco or chew causes cancer of the mouth, tooth loss, and inflames gums. Cigarette smoking causes heart and lung disease and cancer of the mouth, throat, and lungs, while the shisha or water pipe increases the risk of cancers, heart disease, and lung diseases. It is recommended that healthy men and women should drink no more than 10 standard drinks a week and no more than 4 standard drinks on any one day. Apparent alcohol consumption was 2.72 standard drinks per day per capita among Australians aged 15 years and over. While the most common types of abuse drugs in Australia are amphetamines, anabolic steroids, club drugs, cocaine, heroin, inhalants, marijuana, as well as prescription drugs. All older adults aged 65 years or above in Australia are strongly recommended to receive annual influenza vaccination, and all Aboriginal and Torres Strait Islander aged 15 to 49 years are to receive annual influenza vaccination. Meanwhile, all Australians aged 70 years and over, as well as all the indigenous people aged 50 years and over are to receive pneumococcal vaccination, and all Australians aged 70 to 79 years are to receive measles vaccination. Unhealthy lifestyle behaviors such as smoking, poor nutrition, or lack of physical activity put us at risk for disease, for which the people need to be educated. There are several tips for client education. First, you need to ask the client if they would like the information. Then find out what the client already knows. Tailor information to match client needs. At the same time, do not overwhelm a client with too much information. There are several stages of change. So first, with a pre-contemplation, that means not yet considering the change. Contemplations, thinking about making a change. Preparation, that is preparing to make a change. Action, taking action and making a change. And maintenance, continuing the new behavior. Motivational interviewing is a method for talking to clients about stages of change. Motivational interviewing focuses on a client's readiness and motivation to change. The three main strategies are: determine readiness for change. You can use a visual skill to help. Through reflective listening, identify the client's reasons for change and build on the reasons for change and find additional resources if needed. So here ends Module 3. Thank you very much for listening.